And we can see the left lobe of the liver here. As we can see, this liver does not look normal. So this liver is heteroechoic. There are some hyperechoic areas in there. And if we can concentrate on the outline is not regular. So this is an irregular outline. I'll just zoom it a little bit. And we can see that the outline is irregular. So this is definitely a cirrhotic liver. Now, in the previous ultrasound, it was mentioned a heteroechoic ecotexture. However, the outline was not clear on the ultrasound. Now we know for sure that she has cirrhosis. So we'll try to see what else we can eke out here from this EUS before we go on to the bubble contrast. So this is the view of the porta. We can see the IVC over here. The IVC is over here. And this is the portal vein. This is the hepatic artery. And this is the common bile duct. The liver segments were beautifully demonstrated yesterday. So I'll go past that for now. And we are going to go trace this portal vein. Now, we would like to know what is the portal vein diameter. So let's see. So the portal vein is 0.9. So portal vein is not dilated. So she is a cirrhotic patient, but the portal vein is not dilated. And as we go along, so the portal vein is divided into the splenic vein over here and the superior mesenteric vein over here. I would have liked to see the left gastric somewhere because she has esophageal varices which are usually supplied by the left gastric vein. I don't see a left gastric takeoff, at least in this axis. Possibly this one.
Yes, yeah. This is the
right
left.
here. Right here. We see this takeoff coming from the.
Can you measure the diameter?
Left gastric. So the left gastric takeoff is approximately 3 millimeters. Can we have the color flow? So we can see that. Right here. So this is the. So this is the splenic vein and the left gastric vein. And we trace this splenic vein because usually patients who have hepatopulmonary syndrome end up having some large shunts. So I would like to take this opportunity to trace, as we do not have a CT scan, CT abdomen for this patient. I would like to take this opportunity to try and trace the splenic vein and see if there is a splenorenal shunt in this patient, which is actually a common occurrence in patients who have hepatopulmonary syndrome. So we trace the splenic vein towards the spleen. Here we have the vein over here. And here it falls. I'm going to reduce the depth a little bit. And we can see it going all the way into the splenic hilum. There are a few perisplenic collaterals. However, we do not see any aberrant takeoff from this splenic vein. So there is no splenorenal shunt for sure. Splenorenal shunts are actually very beautifully visualized on EUS. So until now, any questions, any comments? Dr. Malay?
No, I think you're doing well. Means you have shown the diameters, you have shown the portal hypertension, and there is no evidence of obvious portal hypertension in this case. The splenic vein diameter is shown. You have followed the splenic vein to the hilum, and you have seen that from the upper and lower border of the splenic vein, there are no major collaterals taking off. Maybe you can just check if there are some varices in the wall of the stomach.
Right.
Maybe small varices are there because they don't appear to be any anechoic channels.
So there seem to be some here. So if you can see, I'll zoom a little bit. There seem to be some. So we are at the G junction now, and we can see some vessels here. This patient has already had a EVL done. We see one of the channels over here. So this patient has already had an EVL done. So most of the varices, if they were there, have been taken care of. However, we do see some of the wall collaterals over here.